Hello everyone, I'm Dr. Beena Jaising, Senior Consultant Obstetrician and Laparoscopic Gynecologist working in Manipal Hospitals on Sarjapur Road and in Mom and Baby Clinic in HSR. Polycystic ovary is a condition where the ovaries are enlarged and there are small tiny cysts. As many a time I've heard my patients describe them as small water bubbles found lining the rim or the periphery or the edges of the ovary. Most of the time, most of the women, they interchange the terms polycystic ovary and polycystic ovarian syndrome. They are not identical. Polycystic ovary is an ultrasound finding, and women who have only polycystic ovary are most of the times have no problems, absolute no gynecological issues. Whereas in polycystic ovarian syndrome, the woman who has polycystic ovary also has gynecological issues like irregular or delayed periods, outburst of acne, or there is excessive of increased hair growth over the face, over the hands and in the arms. Many of the women are, most of the time I should say, are either disheartened or unhappy, saying that I've already had treatment, I've undergone a long-term treatment for polycystic ovaries, and see ma'am, it is still there. The medical fact is polycystic ovaries cannot be cured. They are only treatable. We can treat them and keep the symptoms under control. Usually they are chronic or lifelong. Polycystic ovarian syndrome is one of the commonest hormonal issues that a woman of reproductive age undergoes. The main hormonal problem or the issue in polycystic ovary is there's increased or excessive levels of circulating male hormones in the female body called androgens. So what happens if these androgens are in excess in the female body? They prevent the normal growth and egg release, resulting in difficulty in getting pregnant called infertility, and they also cause delayed or irregular periods. The myth that most women have in their minds is, I have delayed or irregular periods, so I have definitely polycystic ovary. It is not so. There are many reasons why a woman should have delayed or irregular periods, and polycystic ovary is just one of the cause. Polycystic ovarian syndrome requires diagnosis both through a scan and a hormonal workup. So, what is the treatment for polycystic ovarian syndrome? The most important and the treatment is exercise and weight loss, which does the trick in 80% of the women. Over and above this, a few women might require hormonal therapy for the treatment of delayed or irregular periods, or medications that try to reduce the insulin resistance in the body, which is also a part of the hormonal imbalance that a woman with polycystic ovarian syndrome undergoes. At this point, I would like to emphasize that there is a very common and a very strong opinion and notion that a woman with polycystic ovary can never conceive. It is not the case. It is very much treatable in combination with good exercise and weight loss and medications that are given for egg formation and release. Pregnancy is definitely possible.